How can a negative STI test be a false positive? When we talk about negative STI test results, there can be some confusion about what that really means. A negative test cannot be a false positive because those terms describe different errors. A false positive indicates an infection when there is none. In contrast, a negative result can be a false negative if it shows no infection when there actually is one. So, let's dive into how a negative test can sometimes miss an existing infection. One reason for a false negative is the timing of the test. Many sexually transmitted infections have a window period after exposure. During this time, the infection may not be detectable. If you test too early, you might get a negative result even if the infection is present but not yet detectable. Another factor is sample collection errors. If the sample is not collected properly, like swabbing the wrong area or not getting enough material, it can lead to a false negative. This is why it is crucial to follow the instructions for sample collection carefully. The sensitivity and specificity of the test also play a role. Some tests, especially rapid tests, may have lower sensitivity. This means they might miss infections that more sensitive laboratory tests would catch. It is important to know which type of test you are taking and its accuracy. Biological variability can also affect test results. Differences in the stage of infection, your immune response, or even where the infection is located, like genital, oral, or rectal, can impact how accurately a test detects an STI. Lastly, while less common, laboratory or technical errors can occur. Mistakes in processing or interpreting tests can lead to inaccurate results. In summary, a negative STI test result can be a false negative if the infection is present but not detected due to these factors. It is not accurate to call a negative test a false positive because that term only applies when the test incorrectly indicates an infection. Understanding these distinctions is vital for interpreting STI test results. If you are at ongoing risk or experiencing symptoms, it is essential to consider retesting and consult healthcare professionals for personalized advice and confirmatory testing when needed.